Actinic or solar keratoses are common, rough, scaly patches that develop as we get older on areas of skin that have been exposed to light over the years. They are most numerous on the face, tops of the ears, bald scalp and backs of the hands, and on the lower legs and feet in women. Even in the United Kingdom, 1 in 3 men and 1 in 5 women have at least one at the age of 70. Some people with fairer skin colouring and who have had outdoor work may have hundreds. They're a cosmetic concern and are sometimes sore when they're caught or rubbed. They have a small chance of turning into skin cancers, about 1 in 1,000 per keratosis per year. There are several ways to treat them, and deciding which modality will be a decision made between yourself and your dermatologist. Efudix is a cream that's been used for almost 50 years to treat actinic keratoses. It contains the active constituent, a chemical called 5-fluorouracil. It can be used to treat individual keratoses or to treat a wider area where several keratoses are present. The treatment always produces an irritant reaction, so its use always will make matters worse before they get better. During treatment, the keratoses will become red and inflamed, but at the end of the course of treatment, when the application is stopped, the treated area will be smooth and keratosis free, although they may recur after a year or two and retreatment can be undertaken. The treated area can be wide, say a whole face or scalp, but most people prefer to treat the affected skin in rotation, treating an area about the size of one palm at a time. There are many regimes for its use in actinic keratoses, perhaps almost as many as there are dermatologists. I suggest starting using a garden pea size of cream to cover the area of one palm, starting 3 times a week, and increase the frequency of application to once a day if it's tolerated. It's most convenient to apply it at night time. About 30 applications are required per area treated, so treatment will take at least a month. If tolerated, the frequency of application can be increased to twice a day. This obviously shortens the duration of treatment, but it is more irritating. Skin irritation is the main drawback, and the treated area will always become red, sore and inflamed. So don't start a course if you're anticipating an important social event or a holiday is coming up 2 to 3 weeks into the treatment. If skin irritation and redness is becoming troublesome, the Efudix can be stopped temporarily, and a mild combination steroid and antibiotic cream such as Fusidin H can be used for a few days before recommencing the Efudix to complete the 30 applications. When the treated area becomes sore, avoid soaps and detergents and use a light cream soap substitute such as aqueous cream to clean the area. Rub a small amount onto the inflamed skin, rinse it with tepid water and pat the skin dry. It's best to start with the area with the most troublesome keratoses first and move on to another area when the first treatment has been completed, although some people want to get things over and done with and will treat the whole scalp or a face, for example, at a time. Be careful to keep Efudix out of the eyes. Efudix can be used on the lips if they are sun damaged, but care must be taken to avoid swallowing it. If the keratoses recur, then Efudix can be reused. It's to be anticipated that this will need to be done every 18 to 24 months. Wearing hats, protecting the exposed skin with appropriate clothing, and the use of a high sun protection factor sunscreen of at least SPF 30 will all help delay or prevent them coming back. Once the Efudix is discontinued, the inflammation will usually resolve within about 5 to 10 days.